Thank you, Madam Secretary, for bringing to millions of Americans access to affordable, comprehensive health care coverage that's going to be there when they need it. I want to thank you especially as a woman. Being a woman can no longer be considered being a pre-existing condition. Women can no longer be charged more than a man for the same coverage. Women have access to comprehensive benefits like prescription drugs and free preventive screenings and free contraceptive coverage and maternity care, which is often left out of coverage. And the days of complicated pregnancy or diabetes or domestic violence being a pre-existing condition, those days are over. You know, I want to say to my colleagues, after a 3.5-year campaign to repeal, to discredit, to even shut down the government over Obamacare, I want to say, get over it. We all agree that there are problems, but these are problems that I see being fixed. And so I want to ask and I want to say that what we did under Medicare Part D can be an example of how we can work together. And in fact, Chairman Upton and I both sent a letter asking for more money for community-based groups to help implement the program and make it work. We can work together. So if you could just briefly say, how are the navigators, how important are they in making this system work for the American people?
Well, what we know, Congresswoman, is that a lot of people are not web savvy and are not frustrated by the website because they don't have a computer, they don't want to use a computer, they don't trust a computer. They need a live human being to ask questions, get questions answered, talk about the plan, talk about insurance. So the navigators play a hugely important role. We have about 2,500 trained navigators on the ground right now. We have thousands more community assisters who are trained and ready to go. About 45,000 agents and brokers have gone through specific Affordable Care Act training, but those individuals working with their clients, customers, and in the case of navigators and community assisters, just the public at large. They're not paid by a company. They are not collecting a fee. They just want to help people get coverage. They're hugely important.
Gentlelady's time. Mr. Olson.